Welcome to Marian Ayurveda. In this episode, we are going to discuss asthma. Those who have experienced asthma even once know how troublesome it can be. We know that asthma comes in different types. For some people, asthma occurs due to phlegm accumulation, while for others, it is caused by allergies. Some people develop asthma after having it in the past, or after a bout of COVID, or following an infection, or after pneumonia in the lungs, and it just doesn't go away. There are also people who are born with asthma. There is a family I know. In that family, the mother had asthma. All 3 children born to the mother also have asthma. Even the children born to those 3, including a baby as young as 5 months old, are receiving treatment for asthma. In such cases, there is a significant hereditary component within the family. From my observation, we mainly see asthma presenting in 4 different ways. One is asthma that worsens due to phlegm. Another is caused by allergies. Some are due to various infections. And then there is the hereditary type. In this episode, we will be discussing treatments for all of these types. Ayurveda has very effective treatments for them. The one that is somewhat difficult to treat is the hereditary type. Even so, it is manageable for us. We have been able to cure asthma, even cases lasting up to 10 or 15 years with Ayurvedic medicines. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. First, let us think about asthma caused by phlegm. How does phlegm cause it? That is, what exactly is it? Well, we all know what asthma is. The internal airways and the various pathways in our entire human respiratory tract. And lungs become significantly narrowed or inflamed and extensively swollen. This narrowing of the airways sometimes happens because thick phlegm gets stuck deep inside, and when this heavy phlegm clings stubbornly to the delicate inner chambers of the lungs, it effectively blocks the necessary airflow, making it extremely difficult to breathe comfortably. So, just like when a physical blockage occurs in a narrow passage and none of our usual remedies seem to work at all, and we feel a sensation as if our throat is completely blocked with cold ice and we simply can't swallow anything. In the exact same way, we tend to think it's entirely because of the phlegm, and we approach the whole situation as if the phlegm is permanently stuck there. This creates a cycle where we focus all our efforts on clearing that stubborn mucus, believing it to be the primary obstacle preventing us from taking a full, deep breath of fresh air into our tired lungs. So one might wonder why it is that when you observe a situation where a person is forced to put in a tremendous amount of physical effort just to breathe normally, young children in particular seem to be very likely to develop a significant amount of thick phlegm. This phenomenon occurs because their smaller airways and developing immune systems react intensely to respiratory stress, leading to an overproduction of mucus as the body attempts to protect the delicate lining of the lungs, which ultimately results in the congestion we commonly see during these difficult periods of labored breathing and respiratory distress. In a very similar fashion, those popular health drinks and nutritional supplements that are frequently mixed into a glass of milk and given to children, though I am certainly not going to mention any of their specific brand names here, if you happen to consume far too much of these sugary powders on a regular basis, it almost immediately causes a significant amount of indigestion and stomach discomfort for the person drinking it. This is precisely why in the case of certain children, even if there appear to be no immediate or obvious side effects from their diet, the consistent and long-term consumption of these items can lead to a situation where their liver functions are no longer operating within a normal or healthy range. Furthermore, because of the exceptionally high fat content found within such processed foods, the body often finds that these substances are not being digested properly by the gastrointestinal system, nor are they being eliminated completely from the body's internal environment. Over time, this accumulation of undigested fats and the resulting metabolic strain can create a cumulative negative effect on a child's developing system, leading to chronic health issues that might not manifest until much later in their lives, despite the lack of early warning signs. The liver, tasked with processing these heavy lipids, becomes overworked and less efficient, which further compounds the difficulty the body faces when trying to naturally detoxify and maintain a healthy balance of essential nutrients and waste removal. Or if you use the AC, there are 2 types of breathing difficulties that can occur. One important factor to consider is that, as we are all well aware, whenever an allergic reaction occurs within our body, the entire system tends to react by shrinking and tightening up significantly. This physiological response is a natural defense mechanism, but it can also create a great deal of internal stress. Furthermore, this intense state of physical constriction and the resulting inflammation can eventually lead to the development of a fever as well, as the body attempts to fight off what it perceives as a harmful foreign invader. In the same way, when we look at the lifestyle habits of men, it often manifests like this through various repetitive behaviors and specific daily routines that they follow consistently day after day. People who engage in all of these specific activities, or those who frequently consume extremely hot Kantari chilies, bird's eye chilies, or whatever local name we might use for these incredibly spicy varieties, will find that the level of allergies and sensitivities within their bodies begins to increase significantly over time. For these individuals, their immune systems become hyperreactive. If they are suddenly exposed to common environmental triggers like dust or pollen, it can immediately cause severe allergic reactions and make it extremely difficult for them to breathe comfortably. Therefore, for people dealing with such heightened sensitivities, it is highly recommended that the regular use of sour or acidic foods such as tamarind, small limes, lemons, or even oranges should be drastically reduced or limited in their daily diet to help stabilize their body's internal balance. Plus, if you take our medicines as well, it is entirely possible to completely cure breathing difficulties caused by allergies. We have helped a great number of people or successfully recover. The following stage of the progression is what we typically refer to as infections that have managed to reach the lungs. Breathlessness caused by infections. I know that often some people even struggle to breathe at night while lying down, experiencing breathlessness. This usually happens after a fever or an infection, or it happens after a fever that has affected the lungs. Mostly, sometimes it could be due to COVID. The reason for this, as we mentioned earlier, is different. In such cases, it means that the viruses or bacteria from COVID or some other infection are still persisting in the lungs, and because of the presence of these viruses, the lungs are unable to function properly. The slight difference they experience is that they get a mild fever, like a slight chill. At night, it's like they feel a bit of a chill. They don't get a high fever. It's just a mild fever, similar to a chill. What we need to do for them is to provide an antibacterial or antiviral treatment. By taking medicines, these are diseases that can be controlled and managed. Next, there are respiratory issues caused by genetics or hereditary factors. These can occur in two different ways. One primary way we identify this condition is by examining whether it is hereditary in nature, which involves looking closely at the family's medical history. For instance, if we discover that someone within the immediate or extended family, such as the grandparents, the parents, the siblings, or even the children, is currently living with or has a documented history of this specific condition, it serves as a very strong clinical indicator for our team. When these individuals eventually come into the clinic to seek professional medical treatment or a routine consultation, we very often observe a striking and consistent pattern where remarkably similar symptoms and clinical signs are manifested across those different family members as well. This recurring pattern, observed across multiple generations or among siblings, helps us to much better understand the complex genetic components involved in the case. Furthermore, it allows our medical staff to provide a far more comprehensive and personalized approach to care for the entire family unit, ensuring that every individual receives the necessary support and targeted interventions for these shared health challenges that seem to run through their lineage. When fatty liver disease progresses through its two primary stages, the most critical objective is to ensure that the excess fat which has accumulated deep within the liver cells is systematically and gradually reduced until it is completely eliminated from the body. If we are successful in achieving this metabolic clearance, then even if we manage to remove the fat deposits entirely, there will be no negative side effects, complications, or lasting health problems for us to worry about in the future. This process of restoration allows the liver to regain its full functional capacity, ensuring that our internal systems continue to operate smoothly and efficiently without the burden of lipid buildup hindering our overall physical well-being and long-term vitality. Otherwise, the fat will move back to the lungs. When we take a much more comprehensive and closer look at the various holistic ways to manage our long-term respiratory health, particularly when it comes to the difficult and often exhausting task of controlling excess phlegm or managing chronic breathing issues, it is quite remarkable to observe that certain specific types of cereals are actually very effective in providing significant relief. In many instances, if these persistent respiratory struggles are primarily due to an underlying allergy, a fascinating natural process occurs. Without us even fully realizing it, the specific environmental factors and the various places where irritating or burning pollen is present are effectively reduced or neutralized by these dietary choices. Similarly, within the profound and ancient wisdom of Ayurveda, we recognize that there is a very specific type of pitta dosha that is directly responsible for these conditions. By focusing our clinical efforts on balancing this internal energy for such conditions, we are able to systematically and effectively reduce the body's overall sensitivity to various environmental allergies. This therapeutic approach ensures that even if a person is exposed to a significant amount of dust or other airborne irritants in their daily life, their immune system remains resilient, and these kinds of minor infections do not easily or quickly turn into more serious breathing problems. In my own clinical practice, I utilize a wide range of traditional fumigation techniques and other time-honored traditional methods that have proven their worth over many centuries. Furthermore, we incorporate several of our specialized panchakarma treatments, most notably Kashayavasti, which is a therapeutic decoction enema treatment, and Vamanam, which is a carefully controlled clinical purification process involving therapeutic emesis. All of these methods are clearly mentioned and detailed in the ancient scriptures of Ayurvedic medicine. When taken together, these comprehensive and holistic approaches represent some of the most profoundly effective and time-tested Ayurvedic treatments available for anyone suffering from the symptoms of asthma. These treatments work by addressing the root cause of the respiratory distress, ensuring long-term health, improved lung capacity, and overall vitality for the patient. Now that we have concluded our thorough examination of the previous section, let us take a moment to transition our focus and move forward to the next significant topic that we have prepared for our comprehensive discussion today.